because of the amazing technology. Really, our hope today is to really pull back the curtain on our practice and show how our practice is growing to better serve all of you. I'm so excited to be here with my colleague, our wonderful nurse practitioner, Jennifer Henning, who I count as a dear colleague and friend. We're going to talk about our team-based approach. We'll be weaving in some of the amazing questions everyone submitted. Man, when we ask for questions, it's like our people deliver. It's awesome. For those of you who haven't had the pleasure of meeting you yet, Jen, would you formally introduce yourself a little bit and share a little bit about your background and how you came to be here and now?
Yeah. So my name is Jennifer Henning. I am a certified nurse practitioner. So a little bit about my background. I've been a nurse since 2010. I've done a little bit of everything. I've done adult ICU. I've done pediatric emergency care. And then I got my nurse practitioner in 2017, where I did adult primary care. I have done pediatric emergency department medicine. But the way that I came to meet Dr. Wada was at Ohio State doing allergy and immunology. I did a specialized mentorship under her to learn about all of these complex immune conditions. And this is just something that I'm very passionate about and that I have loved, that I'm all about putting the pieces together and figuring out what we can do to get the big picture despite things being normal when we know that that's not the case. So that's just something that I just love, the personalized, individualized approaches. And that's kind of what brought me to work with Dr. Wada and join the team.
And even before Ohio State, you had been working within allergy immunology for a good deal of time, kind of in that interim.
So a total of 7 years I've been doing allergy and immunology.
Wow. Yeah. It was interesting. I didn't realize how closely our timelines align. I graduated med school in 2010, and then I finished fellowship, but also I did this buffer year, which I worked essentially part-time on full faculty role, but also was doing medical education. So I went full-time faculty in 2017. So it's oh, look at that. Yeah. It's we know we've been doing this for a while, and it's crazy to think of how the years add up, but it's really that passion that I've seen from our very first meeting when you interviewed for that position at Ohio State, really that I was so thrilled to have the opportunity to continue to work together. And I know we had some big aspirations in our prior roles that we weren't able to, unfortunately, kind of see through kind of in that dynamic. And it's oh, we get another shot, and kind of making that dream become reality. And one of the things we've talked about from the get-go is one of the real big challenges in healthcare is accessibility and getting in and getting to be able to be seen in a timely manner. And really, this is what has prompted to think about growth so early on, 6 months in, and to look at this team-based model, because in reality, it's going to take a team to help those of us who we primarily serve at the Immune Confident Institute, where the immune system has the potential to hit on every single piece in part of our body, from the tip of our head down to the tips of our toes. And not one human can necessarily know all the things about all the things. We have received a really thoughtful question from Jenny, who asked about the different roles, how we work together. Jen, I'd love to hear from your perspective, sharing how our collaboration works from day to day.
We're basically on speed dial to each other. So we are in constant communication. When we get a new patient scheduled with me, I meet with you and just kind of get a really detailed history and in-depth assessment that really just goes beyond your symptoms and your lab work. I want to know about your diet, your lifestyle, your sleep, your environment, your family history from young age until now. What have you been doing that's helping? What have you done that isn't helping? What are those root imbalances that we can identify, and how can we get you to feeling better? And then I take all of that information and I meet with Dr. Wada and we discuss your case individually. Each one of you, like, I will discuss with Dr. Wada about, these are the things that I'm seeing. This is what I'm thinking. These are the labs that have been done. It's important for us not to repeat things that have just been recently done. We are very mindful about the tests that we are ordering and the treatments that we are prescribing. Like, we want them to make sense for you. And we do that collaboratively. We work together to come up with a comprehensive treatment plan and testing plan and get all of those complex cases, because we know that you've been on a really long journey and we want to be able to help you the best that we can.
Yeah. And it really, I was reminded so much of that earlier this week. And I was really fortunate to be able to kind of share my perspective, both like personally and professionally in a new and exciting way. But part of that was really thinking through both my own journey and reflecting on the similarities and differences that we hear from our patients so often. But goodness, that the game of hot potato from specialist to specialist, and the repeating of tests and the poking and the prodding, and oftentimes at the end of the day, sometimes coming up what seems like empty because all the tests are normal. And you're like, okay, but what do we do now? And I think that's one of the places where I really appreciated having that sounding board back and forth, because when it comes to taking care of folks who their tests are normal, but their symptoms most certainly are not, it is like building a muscle, practicing medicine in that gray area. I think for both of us, and frankly, for almost everyone who is practicing medicine right now, with a few exceptions, we've had this wealth of really readily available, relatively easy to order and obtain testing that, frankly, is just amazing to think about how far medicine has come in the last 50 or so years. But we also have not had to work out that muscle that it takes to get comfortable relying on getting that really deep in-depth history, the physical exam, especially when we see folks in person, but also we're reviewing pictures and things on the video chat too for folks who are seeing us virtually. And I think it's really helpful sometimes to run those cases by each other and say, gosh, am I just like, or does this chicken really look like a chicken? Like, I see a beak, I see feathers, but it's clacking. Am I missing anything? And having that sounding board to bounce off one another, I think is really helpful when we are meeting with folks that either frankly didn't read the textbook before their immune systems necessarily went rogue, so to speak. I think really what I've learned too in working together over the last number of years is your willingness to collaborate. And I really appreciated that, you being open to say, hey, I feel really comfortable about this, like in this plan, but what do you think about XYZ? This is a little on my learning edge, or I'm still like coming from things. And I think that for anyone who is practicing in medicine, but especially practicing in these gray zones, it's really helpful to have, and I say this myself included, that you want to be confident in what you know and hold that also equally with knowing that you don't know everything, and that there are certain circumstances where you will hear the lived experience of someone we're talking with, right? And you're like, I don't really know how or why specifically, like what going on under the microscope is causing that specific symptom. I believe you, I trust you, and let's try to figure out together what might be driving that too.
Mm-hmm. And I feel like there's so many, like in medicine, like everybody wants it to be black and white. And when you're looking at things black and white, like you get comfortable. We don't want to get comfortable. Like that gray zone kind of pushes us and challenges us and really keeps our minds fresh. And it's not so much of like a routine, and it's really having you think outside of your box. And for me, like I love a good challenge. I love like a mystery of trying to figure out and put the pieces together, because I know that everything isn't black and white.
No, that'd be a lot easier.
Right.
That collaborative piece, I think, is really important. As you mentioned, many folks have been, when we ask that question of like, take me back to childhood, as you think about your health compared to your siblings or your peers, did you notice anything different? Or talk to me about like how things went through your early 20s. Like often we'll hear those breadcrumbs along the way as folks were kind of on that journey. Amanda asked the question too, like when you have a complex history in normal labs, where do you begin in that visit?
Yeah. So it's so important to like, I love just listening and hearing those stories and just validating your experience and your concerns. I want to be there for you. And you know what? I want to build that relationship and I want to build that trust. And a lot of people will be like, this might be silly, but, and usually it's those little silly things that we don't even think matter that are one of the biggest like light bulb moments. Like, oh, hey, yes, that does make sense. Like that totally adds up. So that's why I really want like to have that conversation and back and forth about everything, and nothing is off the board really. And I think that that is just so important, because when you come and see us, we know that you've kind of been through it all, and we're here to bring everything together and look for those things that aren't black and white.
Yeah. And I would say, like, for those who haven't been through it all, our goal would be to help prevent you from needing to go through it.
Yes, absolutely.
In the perfect world, we help reach people before they get to that point, right? And I think that goes back. We think about the framework put together as part of the Immune Confident Institute. The first part is recognizing, and it's for all of us on the team to recognize, like, what has been your lived experience? What are some of those triggers we're picking up on? What are some of those pieces of the puzzle that are kind of snapping into place to say, oh, yeah, that makes sense. And this might be what's driving it. To then allow us to kind of, as we're coming into, okay, this is where we're at. Here's what we're thinking. And putting together that plan as it's the best of group projects. Yeah. The best case scenario of a school group project where we all are contributing, and then saying, okay, well, how can then we start to reclaim and get some headway back to getting back on track with where we thought life was headed, push back against some of the and rebel against some of the issues within medicine, navigating medicine, but also some of our limiting beliefs and frankly fear that often will develop with whether it's going on an outing or trying a new food, or everyone's situation is a little different, and then really rise and feel better and confident in navigating our health. And we've talked a little bit already about the importance of listening and building trust. One of the ways that I have really appreciated your help in coming on the team as well is when one or the other one of us is seeing patients, it gives some backup to help respond to some of the messages too. I think one of the things we realized early on, even in our prior roles, was that there often are a lot of questions that will come up between visits. And that takes time and energy and attention to answer those too.
Yes. Yeah. So you might see me, or you may have already received a message from me. And I've even heard from a few patients. They're like, I really appreciate your in-depth explanations and how much detail you went into. And patient education is also a big passion of mine. I've been in an education role before I became a nurse practitioner with patient and staff education. So I just really, I want that buy-in. Like, I'm going to explain the whys, I'm going to explain the hows, because a lot of people are like, do this, but they don't tell you the why, or it would be better if you do this. Like, does that make sense for your lifestyle? Like, how can we incorporate that? And that's the biggest thing, is we want to do things that make sense for you and for your lifestyle and meet you where you're at. Because if I tell you, like, you've never ran a marathon in your life, and I say, hey, go run a marathon, like, that just doesn't make sense. I try to make things customized to you and where you're at. And back to like the messaging and things, I'm going like, we try to be like, I try to respond as quickly as possible. Like we're kind of on there during day hours, but I'm also kind of checking in other times too. Yeah. Don't feel bad sending questions. And even like I said, there's no silly questions. Like we love all the conversations back and forth.
And we like workshopping stuff too. Like you're like,
Yes.
okay, well, in a perfect world, we do XYZ, but given these parameters, what could we do instead? And I think that comes up a lot, especially I would say I had someone ask, like, as you think about your practice, what do you think the breakdown is in regards to kind of percentage and diagnoses? And frankly, we haven't like done any tally lists. My guesstimate would be that maybe somewhere around 40% of patients either have a diagnosis or suspect a diagnosis of Sjogren's disease. My guess is there's maybe about equal that also that mast cell activation, and there's some overlap in those folks too. And then we have a number of folks who have other inflammatory disorders, and it's across the allergy into the autoimmunity spectrum. So, certainly folks who are coming to us for like their seasonal allergies and interested in intralymphatic immunotherapy. We have some folks with eosinophilic esophagitis, an allergy condition that affects the gut or the food tube and the gut. Folks with rheumatoid arthritis and other autoimmune diseases that are wanting to use lifestyle to help add to their game plan as they're also maybe working with their rheumatologist. I guess you've kind of been a little newer to, so Jen joined us over summer.
Yes.
Yeah. And so about half the time we've been open. Would you does that sound about right to your kind of guesstimate?
Yeah. Yeah. I would guess.
Okay.
And like a little bit of like some hypermobility thrown in there.
Oh,
I've seen
absolutely.
quite a few patients with hypermobility.
Yeah.
So,
Yeah. And kind of that overlap.
yes.
Yeah. Thank you. I didn't mean to forget that. It's hard because it's like the Venn diagram that has like a whole series of rings, not just the two that are overlapping for sure. Chris, did you have a question? No, you just hit your button. It's nice to meet you. Yeah, looking around, it looks like we have a great mix of like current patients and maybe folks interested in the practice too. Hey, Lawrence, it's nice to see you.
A quick thing for all of you. I've been under the care of Dr. Wada for 2 years. I saw 14 physicians until I met Dr. Wada. No one could help me out. And I discovered something. I went to my pharmacy and I wanted to look up. A doctor even put me on desmopressin. They assumed that I had diabetes insipidus. And I will tell you, for years, the thirst was unbearable. I drove my wife crazy because I would awaken maybe 10 times drinking tremendous amounts of water. Until Dr. Wada explained to me, you have Sjogren's. I went to 4 rheumatologists. They all said, no, you test negative. You don't have Sjogren's. One doctor even referred me to a psychologist, said it's all in your head. And now I just want to tell you, I'm sorry I interrupted you all, but that confirms that 40% factor that test negative.
Yeah.
Hello, a lot to you, tremendous amount. And I made some other discoveries, but we'll discuss it. Sorry to interrupt you.
No, thank you, Lawrence. I always appreciate your sharing your story and experience. And it was interesting conversation that I had kind of in sharing that personal professional overlap this week. Part of the role I was kind of playing in the conversation was talking about how did we change this paradigm of seeing in this context, it was Sjogren's, but I think it's a very similar conversation with mast cell, where there's this incredibly high barrier or high bar, excuse me, for hitting all the checkbox. And at what point are we doing more harm by saying no, you only hit 4 of the check boxes instead of 5, in saying it's not it. And then also not offering some sort of next step forward versus, okay, well, here's what's going on. We've hit 4 of the 5 check boxes. It sounds like a duck, quacks like a duck, kind of whichever condition we're talking about. Now let's talk through what are the pros and the cons of XYZ options and decide together in our minds what makes the most sense based on what you're experiencing, and talking through like, okay, do we think in our minds that the risk of trying maybe a treatment or medication or something for 6 months to see if it's helpful or not, if that feels like the juice is worth the squeeze or not. And that's what the changing minds, I think, ingrained is going to be tough. But
a physician, a great physician and diagnostician, their ability to think outside the box. Yeah. Do not go by what the data says. You have to look at the whole patient. There are telltale signs when you do an intake exam, palpating the patient. They don't do that anymore. They don't even use a stethoscope anymore. That's what makes a good diagnostic.
Well, we will say that one thing we're excited about with Jennifer coming on board and our growth and evolution of the practice is we will have the ability to see patients in person more often. I think many folks probably know one of the reasons, so a few reasons this started out as primarily telehealth. It is in part due to some restrictions that are kind of baked into most physician contracts now, which are non-compete clauses. And there was a bit of that. Also knowing that there are a lot of folks that are trying to access care and are not able to do that locally necessarily. And so there is kind of a dual purpose there. But Jen and I are working on having some office space together, which will be really great. Yeah. Hey, Jennifer. Nice to see you. Do you want to unmute yourself and chime in?
It's nice to see you too. And hi, Jen.
You together.
Yes, I was like, wait, are you talking to me? And that I was like, okay, no. But one interesting thing with being on disability and having to provide all of the forms, OSU stuck me on disability. So I usually have to send in the 30 doctors per year that I'm seeing, because somebody sent me to them, not because I chose them. And somebody always finds something, because I am that one who probably shouldn't have lived outside my mom's womb, because everything's not according to any rule book. But Dr. Grubb, when I finally did get to him, which took a while, 2.5 years, like Dr. Rahman, who used to be an OSU cardiologist, said it would take 2.5 years, get on there now. He did say that, and I know Dr. Goodman shares this in the dysautonomia conferences, and I think he spoke for you. I just didn't know about your conference.
No, I would love to have him speak. If you have a way to get in touch with him.
Oh, I will be talking to him, so I'll let him know.
Yeah, if you can help make that love, man.
Dr. Little connection by answering my question, but not HIPAA. He said, for those of you who have Sjogren's and have had severe elevation sickness and are experiencing that REM behavior disorder, please contact me. That was my question to Dr. Grubb the day before in his office. And that weekend was Sjogren's. And when all the doctors came up on Sunday who were left, that's how he answered Dr. Grubb's question to me by letting him know that he knows REM behavior disorder, because I'm getting up and totally acting out my dreams, which is a little scary with a BiPAP on and central sleep apnea. But both of them have mentioned, Dr. Goodman was, I believe, last year, and Dr. Grubb is every time I see him. We have 2 or more connectivity diseases, which I'd have to look up and see all they are. But in particular, I think something maybe that's been proven. So mine would be like small fiber neuropathy. I was positive on that test in 2013. So I'm on the 16th year of all this fun. But then Ehlers-Danlos was proven for me and all my kids. And then I did go through Cleveland Clinic's autonomic dysfunction testing. I was abnormal there. He said, both of them said, we don't need to go with blood work. If you have the symptoms, we treat the disease. So I said, could I really actually have Sjogren's? Because 9 doctors are giving me medicines for dry stuff. And he goes, well, then figure it out. Yes. And Dr. Goodman was like, with mast cell, if you are experiencing all of the mast cell symptoms, we immediately put you on either, I'm going to forget, Zyrtec. And so I had trouble getting OSU to accept that. In fact, I think it might have been in your department, which I understand because to them you don't. But that's just something out there for those people. Look up. I don't know the connect. You all, I'm sure, know. Looked up all the connectivity.
Well, in general, our connective tissues are all the things that keep us together. Our skin, our muscles, our bones, our nerve, and part our nerves are part of that too, to some degree. But conditions that affect those parts and pieces of us. Yeah. So, and for those who are familiar, Dr. Brett Goodman is a neurologist. He is located out, I think, most recently in Arizona. And then Dr. Grubb is an electrician of the heart, electrophysiologist up at Toledo, and he's been a real supporter of those with autonomic dysfunction for years. Rumor had it, maybe he's edging towards retirement, maybe.
His partner.
Okay.
The family emergency, and he told her to go. And she was working on training someone for 2 years. So he did take on her patients. But right now I'm not sure if he temporarily put a stop on new patients, but I don't think he is anywhere near, he's not done.
Okay, well, that's great. For any questions about kind of from folks tuning in about kind of how the practice works, questions for Jen to get to know her better. Yeah, Chris, please.
No, my question has to do more with timing. I know you've been talking about this for a while. Is it something that's going to be like you have when it's going to happen or not yet?
Oh, we have a patient. We have it. I haven't signed the lease because the lawyers are still working on the lease.
Gotcha.
So we have this space and I mean, I just haven't signed in the line because I haven't had the ability to quite yet, but it is in kind of the northwest corner of Columbus, Sawmill, Bethel Road area.
Okay. Anxious to see you in person again.
Yeah, it's there's a really nice Aldi next door, and it's across from Ortho 1.
All right.
For those who are in the neighborhood. And it's not terribly far for those who may think about coming to see us in person from outside of the central Ohio area. It's not terribly far from some relatively main roads. Yeah.
It is absolutely beautiful.
And it doesn't have any funky smells. It's like a medical condo. There's a colleague of mine that I've known for years who is an internal medicine and pediatrics primary care physician. She has her own practice, and it's at least kind of our initial spot will be in her location. And it's a nice mix of like warm and comfortable and also clean and freshened up. The one thing I will say, and I know I all questions and requests on space in regards to trying to help make this space be as comfortable as we can. I don't have any ability to change the overhead lighting situation. So it does have some fluorescent lights, but the room that we're planning on using primarily has a window. And as long as we don't need to have the blinds totally closed for a privacy reason, then we can turn off the overhead light and use the natural light for those who are more light sensitive.
Thank you.
Yeah. Yeah. The address will be listed officially probably January 29th if you're trying to Google it. Until then, we will share that with you on a kind of as needed basis. And yeah, I guess now that you're with us, Jen, then we have a little bit of a workaround. OSU has deep pockets, and one does not want to get them angry with you, despite our small small stature and practice numbers. Currently, Jennifer, do you want to kind of share like who you're able to kind of see, like in that sort of thing too, from a licensing standpoint in our plan?
So right now I can see patients in Ohio. I am working on getting licensure in other states, but of course there's hurdles to everything that should hopefully be coming in the next few months. I know Florida was one of the big hitters, and I think Texas. I think those are on my top two that I'm going to be working on first. But just as like a nurse practitioner, like there's a lot of limitations with only having an Ohio license. So I'm going to be also working on a compact license, which means 43 out of the 50 states, I'll be able to respond to questions, maybe not so much give medical advice, but still, like if I see it's something that I can draw to Dr. Wada's attention. So yeah, that's in the process. But right now, just Ohio patients, and I'm seeing patients on Thursday mornings, but hopefully opening more availability after the new year.
Yeah. And thinking about we're thinking maybe Friday, because that
yes, Friday's kind of the goal. Yes.
Yeah, which is great. Especially as things kind of build up during the week. And if we having that pop off valve for folks that are like, oh gosh, like what has hit the fan, I need to see someone. And if my schedule is booked or like having that ability to have some extra bandwidth and some flexibility to get folks in for those. Sometimes there are some urgencies that we want to be able to help with. And as we think about ongoing growth, like this wasn't part of kind of our outline of things, but I would love to just like, in a perfect world, we would love to connect if there's someone who has interest in helping provide more comprehensive primary care for our patients. Like that would be an incredible addition, I think, to what we're able to provide our patients who are kind of long-term patients, so that you're not having to like reinvent the wheel all the time. I've already put out planted a few seeds with a few colleagues who had taken a little time away from more full-time clinical practice as their kids were real young. And so I ran into a colleague, I think I told you, Jen, like at the Ninja City at a birthday party. We were joining birthday parties. And I was like, hi, colleague, it's so great to see you. I heard your youngest is in kindergarten now. Do you want to come back part-time? I'm trying to find someone who is comfortable with some of the complex physiology that goes on between the nervous system and the heart and the immune system and the GI system, all the things. But frankly, I never practiced as a primary care doc outside of residency. And so I give so much respect and credit to my colleagues who practice primary care full time. And I really think for our patients, in my perfect world, we have someone who that is their dedicated area of focus, and they are up to date on like, well, Chris, XYZ, you should get a colonoscopy, or your cardiac risk factors are ABC. And so maybe we should do this, or I'm just kind of making up examples of things that really, I think, as we think about trying to help folks, of course, like goodness, if we could find some other specialists who are interested, by all means, I too. We have time maybe for a couple more questions if anyone might have some.
I think Bonita has her hand.
Sorry, Bonita, I missed your hand up. It's nice to see you.
It's nice to see you. I just kind of wanted to jump on and kind of introduce myself to Jen. I feel like I already know her because she puts up my nice messages all the time and my boatloads of medical. But you know what? I'm seeing the end of the tunnel. I went to see a gastrologist yesterday. So I'm clear that's out of the way. So now we just got the neurologist, basically, and the orthopedic surgeon for my neck and spine issues. But I'm seeing some daylight. I've increased the LDN and feel great. I just overdid it yesterday. That 3-hour trip just did me in. So today is a down day, but I started my day out having the ocular migraines in both eyes. So we're living in sunglasses again today. But I just wanted to say thank you to Jennifer. I'm just very grateful to her. I'm just
I don't even know how to express it because I've been chasing all of this and to Dr. Wada for over 30 years, but I really do believe I was born with this because, like I told Dr. Wada at 8 months, I nearly died of dehydration. So I think I was literally born with a problem. Always been a problem child, but I have a Sjogren's diagnosis and dysautonomia with all the rest of them, and I'm happy. At the point, we just got to figure out the muscle weakness. So, Jen, you're probably going to get a lot more obnoxious messages from me.
You're not.
Never obnoxious. Never. No.
I
And
love
it's
it.
been great connecting with you.
Yes, thank you. I'm very grateful to your team, Dr. Wada. I really am. And whenever you get that building ready and you're ready to move,
Why not?
let me know because I'm cleaning house right now.
Yeah, we're.
Library. So thank you.
I think our next task with the actual physical space, Jen, is we have to pick out some furniture for the room.
What else? I mean, do we need to bring a lawn chair?
No. So Dr. Lehman's space, she currently has 2 offices that are furnished. And on the occasion that we've needed to see a patient in person, I use the furnished office that she doesn't use most of the time. But we'll be in the office right next door to that. And so we get to kind of pick out our own things. And so that's why I was asking in the Facebook groups and on social media to say, hey, what would make that space more comfortable to the best of our abilities in knowing and frankly, I think this approach to our growth is we're trying to be thoughtful in regards to not over expanding. And frankly, rent in the Columbus area is pretty expensive. And so finding a place where, goodness, we're able to have some community with another pretty like-minded physician and also just kind of turn it into more of like a turnkey kind of space where, yeah, we have to pick out the furniture, but I don't have to worry about an additional electric bill or cleaning service or some of those things that I don't think we're quite ready for yet. And we'll get there. I know we will. I think Priscilla put in the comments, it's been her dream to have a comprehensive Sjogren center. And oh my goodness, yes. Part of my next week, I won't be in the office. I'll be doing some kind of part of what I'll be doing is some dreaming about what maybe things look like 5 or 10 years from now, hopefully sooner. But what might that look like? And what would we need to pull that together? And I know one of the things, Jennifer, you've told me that you have some interest in too is also, as we grow and expand, is there a role to help kiddos and adults with food allergies? There's a lot of advancement that's happened when it comes to treatment of food allergies. And certainly we think of true food allergy in our little kiddos, but so many of our adult patients are dealing with things that may look and feel and act like food allergy and might be more of an intolerance or sensitivity, but kind of thinking through how to help people in that way too.
Yeah. And my passion from that comes, I myself have had food allergies my entire life. I've also dealt with like autoimmune issues since 2019. My kiddo has food allergy. That's definitely what kind of brings me in and draws me to like the allergy and immunology. Like I'm not just looking at it from the outside, like I've lived those experiences as well. So that's just part of what makes me passionate about what I do.
Yeah. Lawrence, unmute yourself.
2 questions. Kara, in your opinion, which Dr. Wada, Kara had talked about it, when she was 20 years younger, or 30 years younger, 5% of the population had, you could say MCAS, Sjogren's, or whatever, all these autoimmune disorders and allergies. And as you say, it's up to 30 to 40% of the population. Your opinion, is it due to food additives, pesticides, more growth in the cities, more pollen, but not everybody's allergic to pollen, even fruits. So I wonder, is it getting worse and why?
And I think you're onto something. And I don't think that it's just one single thing. I think that there's multiple things that are playing a role and just kind of all mixing together. Yes.
Perfect
So
storm.
you're definitely onto something there.
Yeah.
Oh, you autoimmune disorder, type 1 diabetic for 55 years. So as Kara told me, it usually comes in pairs or in threes. You have one autoimmune disorder, you're going to end up with two more. And it keeps building. And I presume how I ended up with MCAS, my immune system remembered something and didn't know how to forget it. Not just in relation to an antigen, a virus or a bacterium, but any other exposure. And I'll tell you what exacerbated both my conditions, MCAS and Sjogren's, I think was, and I had 4 inoculations. Now, Dr. Wada told me, you know what? You lost your sense of smell and taste. Of course, COVID-19, but I didn't even have any symptoms. And yet, so obviously, I got exposed to COVID, the spike virus. And I wonder how many more patients you end up seeing who never had an autoimmune condition. And now all of a sudden they had COVID, and now all of a sudden they have autoimmune disorder. Is that correct?
And you're not the first one to have told me that. I have heard that quite a lot. It seems like 2020 was like the switch of things. Yes.
And I'll tell you, I ended up with gastroparesis. And now I read 4 medical papers that say that the spike virus can cause damage to your vagus nerve and gastroparesis. And mine is intermittent.
Yeah.
Some days I don't. It's a faulty vagus nerve.
Yeah. I think what's fascinating, Jen, I would suspect kind of prior to COVID, our boogeyman for viruses was Epstein-Barr in a lot of ways. Like Epstein-Barr or monovirus is just kind of known to be it can cause a really wicked sore throat. And for a percentage of patients, it can cause your spleen to become enlarged, which can be life-threatening in some instances. But it also can leave a mark, or it can essentially turn on your B cells, which are part of your immune system, and make them behave funny. And we're still trying to fully understand all of the ways that COVID messes things up. But I suspect at the end of the day, we might say, gosh, we're kicking you off of your pedestal as the virus that causes the most problems, EBV. COVID, you've taken over, just because it has so many different ways that it affects our immune system, our nervous system, our blood clotting system, in various ways.
I think that it continues to mutate, less virulent.
But still, with subsequent exposures, there still is risk of developing long COVID, which I think is what's worrisome.
Yeah, I'm definitely along.
Yeah. Well, all right, Priscilla, since vagus nerve came up, here's a related question. Have you heard of a new home device that claims to stimulate the vagus nerve? Is there any known benefits to trying to stimulate it? So there are a few different devices that are out there. I have one, and I was wearing it this week, and I went to recharge it, and I didn't put it back on. There's 3 main ones that I'm aware of on the market. One is called Apollo Neuro. You can wear it on your wrist like an Apple Watch, on your ankle, which people will ask you if you are on home release, if you wear it on your ankle. And it also can clip onto your lapel or your waistband, and it vibrates, and it kind of feels like a purring cat. And you can increase and decrease the frequency and the intensity of it. That one tends to be the most gentle, but I have had some patients who also just do not find it feels good to them. There's another one called Sense. And so that you usually will wear while you're awake, wear while you're asleep, ideally 90 minutes awake, 90 minutes asleep within a day to get maximum benefit. There's another one that you wear around your neck called Pulsetto, and you'll usually wear it there, I think, for somewhere between 5 and 15 minutes, once or twice a day. Forgive me because I don't know the specifics, but it's more episodic. That one you use a little gel to make contact with the neck. And I have heard that there is a bit of like a sensation, maybe akin to like a TENS unit, that there sometimes is like some electrically kind of sensation. And then Sensate is a handheld device that you hold over your chest. And that is also used, it's more similar to Pulsetto, like in kind of those episodic. So I think those are all, it's all interesting. They're all similar-ish price points, somewhere in maybe $300 to $500-ish range. The data is a little more geared currently, those products, the data is a little more geared around improving focus, improving deep sleep, quality of sleep, quantity of sleep. They have not looked at, as far as I'm aware, more of like the inflammatory markers or specific disease processes. So that's a little CME on that. Yeah. Any closing thoughts, Jen? Because I'm going to have to hop off. I have a patient at 2.
Oh, well, I'll tell you real quick for gastroparesis. I discovered something which helped me because it's intermittent. 2 techniques you can do. One is stimulate your vagus nerve here, rotate around your ear, and then you do here. Does calm it down. The second thing is, if you have gastric discomfort due to gastroparesis, you can do external massage, and that'll help empty your stomach into your small intestines.
Helpful. Awesome. Ooh. Yeah, I think this would be great, Priscilla, to do this. And we've talked about in the new year and kind of with our expansion efforts, trying to have maybe a monthly meetup where we do some Q&A or other things along those lines and kind of work those into the routine. Any closing thoughts, Jen?
Yeah, so thank you so much for joining us. So nice to meet you all virtually. And I'm really excited to partner with you all. I know it's not an easy journey, but we are here for you. We hear you. We see you. And I just look forward to working with all of you to create positive changes and know that we are always here. And I think Dr. Wada has put a link to schedule with me. I see new patients as well as follow-ups. And even if you like see me, that doesn't mean that you aren't seeing Dr. Wada. Like we go back and forth. Like you can see both of us. So don't think that just like locks you into like one or the other of us. So we collaborate on everything.
Teamwork makes the dream work.
Yes.
Sorry, I had to. So we have, for folks who are interested in maybe joining the practice, we put together a new, like, are we a good fit form, just to get some of that information so that our team can reach out. And then there also is some information on our new patient care page too. And I look forward to seeing you soon, Mandy.
One quick thing. I congratulate both of you.
Thank you, Florence.
Thank you.
And your practice is going to grow to the extent you're not going to be able to handle it because I'm going to refer a lot of patients.
Well, we appreciate that. And I mean, that, I guess that is that, honestly, that's the best compliment is getting those referrals from within our community. And I mean, I would have to estimate that, goodness, probably a third of the folks we see are from those personal referrals. A third are probably from support group postings and asking, and a third from like our colleagues sending us. So it's a great mix, and we're so grateful for all of you, and really happy and excited to partner in helping work towards whatever those goals are that you have for your health and your life.
What you're doing is fixing broken medicine.
Well, we're trying. It's not perfect yet, but we're working on it.
We're doing our best right now.
We're doing the best we can with what we have.